I'm Jill Jessa-White from Community Health, bringing you our Unity Through Community video blog, because your health is our mission. In this segment with Ashley Rick, mental health counselor at Community Health Castleton, we'll talk about the different types of eating disorders. Hi, Ashley. Thanks for joining us today.
Hi, Jill. Thanks for having me.
The National Eating Disorders Awareness Week is February 23rd to March 1st. Can you please tell us what an eating disorder is and what causes it?
Sure. So, an eating disorder is a range of psychological conditions that cause unhealthy eating habits to develop. And it might start with an obsession with food, body weight, or body shape. Some symptoms might include severe restriction of food, food binging, purging behaviors like vomiting or over-exercising.
So what are the different types of eating disorders and what symptoms would you see?
Yeah, well, first I'll start with some stats. It's mostly seen in adolescent young women. 13% of youth may experience at least one eating disorder by the age of 20. It is seen in males, but it's definitely less likely. Some causes can be a variety of different factors: genetics, personality traits, or cultural ideals. And some types are anorexia nervosa, bulimia nervosa, binge eating disorders, pica, avoidant restrictive food intake disorder. But I'm going to go through anxiety nervosa as well as bulimia nervosa just because in the interest of time. So as for anorexia nervosa, they view themselves as overweight even though they're dangerously underweight. Some symptoms are very underweight, restrictive eating patterns, an intense fear of gaining weight, and distorted body image. There are two subtypes: restrictive, lose weight solely through dieting, fasting, or overexercising, and then binge eating and purging. Binging, then vomiting, extreme exercise, or taking a laxative. There is damage over time, thinning of bones, infertility, brittle hair, and nails. And in some severe cases, it can result in heart, brain, and multiple organ failure or death. And bulimia nervosa is eating large amounts of food in short periods of time, unable to stop, then purging to compensate for the calories consumed. Purging behaviors include forced vomiting, laxatives, and extreme exercise. It's kind of the same as anorexia. However, they usually end up maintaining a normal body weight, so it's kind of harder to detect. Some symptoms: recurring episodes of binge eating with lack of control, recurrent episodes of purging behaviors, self-esteem overly influenced by body shape or weight, and a fear of gaining weight. And the damage is inflamed sore throat, worn tooth enamel, tooth decay, irritation of the gut. In severe cases, it can cause stroke or heart attack.
Well, thank you very much for explaining that. So what are some of the signs that I would look for in a loved one? If I have concerns, what might I be seeing?
Yeah, so, it's excuses not to eat, to skip meals, overly restrictive, like vegetarian diets, or making their own meals in the home. Like you're making a family meal and they're like, no, I need to make my own meal, counting calories, withdrawing from normal social activities, excessive exercise, and expressing depression or shame when eating, before eating, after eating, anything like that.
Well, so what can we do to prevent eating disorders? And then what are some treatment options?
Yeah, so prevention really comes from having healthy conversations with your family about what a healthy body looks like, body positivity, and just having those open and honest conversations with your kids, teens, really just kind of talking about what a healthy diet looks like and what it should look like. As for treatment options, there is inpatient treatments, partial day program treatments, and outpatient. Family treatment is really highly recommended just because a lot of individuals who are struggling with eating disorders are adolescents and they live with their parents. So by having the whole family involved in treatment is really important. CBT, interpersonal therapy, they're all pretty big ones for eating disorders. And I know in Burlington, there is the Adams Center. It's called the Adams Center for Mind and Body. It's in South Burlington. They have groups. They're a wonderful resource locally for us. You know, Burlington's a little bit of a trek, but it's definitely a great resource. Also, the nationaleatingdisorder.org is also a website that has plenty of different things on it. And then the helpline, which you can text or you can call, and it's the 800-931-2237.
Thank you so much for sharing those information with us. What I'm going to do is I'm going to put those two resources that you just mentioned in the description for the video so that people could get to those easily. And I really thank you for your time and your insight.
Thanks, Jill.
So this is the episode of the Unity Through Community video blog. If you're interested in finding out more information about our organization, you can go to our website at chcrr.org. Community Health, where your health is our mission.